welcome to my channel. My name is Lisa Alistway, and I create fun, inspirational, and informational videos you can use and apply to your life. Today's topic is binge eating disorder. But before we get into it, please hit the subscribe button and the bell to be alerted when the next video drops. Okay, let's get started. It is my honor to introduce Dr. Caryn Honig, who is a registered and licensed dietitian in Houston, Texas. She is one of the first dietitians in Texas to operate a nutritional counseling private practice specializing in eating disorders. She has helped thousands of individuals who are recovering and have recovered from eating disorders and healing their relationship with food and body image. I will be linking her website information in the box below. Caryn, welcome. Would you like to include anything else with regards to your background and experience and choosing eating disorders as a career field?
First of all, thank you so much for having me on today. What a privilege and honor to be a part of this exciting YouTube channel.
Thank you.
So in terms of anything else I'd like to add, I've been in private practice for about 25 years. And I have to say what an honor and a privilege it has been to work with thousands of clients who have allowed me into their lives, right? Nutrition, food, body image is so personal and so individual. And what a privilege to be able to step into the place of their space and their lives and to be a part of that, because it takes such, they have to really trust me, and bring down the walls for me to help them heal. So it has been such an exciting 25 years. And then also to watch the field of eating disorders evolve. When I first went in to the work of eating disorders, there were no treatment centers in Houston. There were no residential treatment centers in Texas. We had to send our patients outside of Texas. Now Houston has two IOP PHP programs. There's probably 20 dietitians in private practice. We've learned so much. The DSM-5 changed and added different eating disorders into the diagnostic codes. So it's really an exciting field. We know so much more, we've evolved, and we can help treat patients so much better.
Yes, and I just want to provide a disclaimer. The purpose of this video is for educational purposes and it's not intended for medical advice. So we're hoping that with this video, it perhaps can provide a tool or a discussion that you can take with you to when you see your doctor the next time, if you think you have a binge eating disorder.
Absolutely. And if I could add, there's absolutely no shame, in having a mental illness, an eating disorder, any type of addiction. I am in recovery. I had an eating disorder in a time when nobody even knew what anorexia or bulimia was. I was a tennis player on the junior circuit, and I started that at 13 years old. And so I was a nationally ranked tennis player, in a stress bubble. And so my coping mechanism was eating disorder behaviors, and nobody talked about it then. Nobody knew what it was, so I had this very shameful secret. And there is no shame in being human and having problems and needing help.
Yes, yes. So your story is very inspirational, and I'm glad that there are a lot of tools and resources available today. And it's tough if you grew up at a time when that wasn't available. But you are proof that people can recover. Yes. Okay, so let's go ahead and begin. As you guys know, this last year has been very challenging for everybody with the pandemic. And I just wanted to bring to your attention the latest American Psychological Association report. It's titled, let me make sure I get the title right here, Stress in America, 1 year later, a new wave of pandemic health. There is a lot of key findings in this report, but I want to highlight just a couple because I think it's relevant to today's discussion. One of the key findings, and this is just in a year's time, keep in mind, people, that approximately 6 in 10 adults experienced undesirable weight gain just in the last year. It was approximately 61% of us. And if you were to break it down by groups, millennials, and that's ages 25 to 42, they reported the highest undesirable weight gain of any group, with an average weight gain of 41 pounds. So I'll be linking this report down in the description box below if you would like to read it. But this is very alarming. I think a lot of us are not surprised. We might be surprised by the actual numbers that are coming out though. But to start off, I really want to differentiate between overeating and binge eating disorder. So Caryn, can you do that?
Now, that's a great question, because I often hear people say, "Oh, I binged last night," or I always gives me this gut, gut reaction, like, no, you probably overate, and that's a normal, that's normal to overeat sometimes. That's part of the definition of normal eating, is overeating sometimes. Um, but there is a difference, and overeating is just like I said. Overeating, you feel it when you overeat. Maybe you go to a Mexican restaurant and there's tortillas and dip, chips and dips, and then fajitas, and then margaritas, and you feel like, oh my gosh, I'm really full. I overate, right? Binging is a numbing, addictive behavior. When binging is out of control, eating until the food is either done or you are so full that you are physically sick or uncomfortable. Binging it's a psychological problem, right? It is in the DSM-5. It's binge eating disorder, and there are certain criteria that one has to meet in order to be diagnosed with binge eating disorder. So I love that you asked that question, because there is a difference between overeating and binge eating.
Yes, I assume from this report, a lot of this is overeaters and not necessarily people with binge eating disorder.
Agree. And when I read that report, I had the same thought, that then the way they phrased it, undesirable weight gain, this was a really tough year, a lot of stress. It makes sense that people turn to food for comfort and for other reasons, and that weight gain was the end result.
Yes, yes. So when we talk about binge eating disorder, can you describe what a binge is?
So a binge is different for every person. I lead a binge eating disorder support group, and each one of them, their binge is different. But in order to be diagnosed with binge eating disorder, there are different criteria. And the first criteria is recurrent episodes of binge eating, which is eating within any 2-hour period an amount of food that is definitely larger than what most people would eat in a similar amount of time under similar situations. And there's a sense of lack of control over eating during this particular episode or these particular episodes. So that's one criteria. And then the second criteria is that episodes are associated with 3 or more of the following: rapid eating, eating until uncomfortably full, eating large amounts of food, eating alone, and then feeling disgusted, depressed, or guilty after eating a bit, having a binge.
Yes.
So that's 2. Then there's marked distress regarding binge eating. And then in terms of amount or timing, the binge eating occurs on average at least once per week for 3 months. And then finally, the binge eating episodes do not have the component of purging, right? So that would be bulimia, correct?
Right. So purging would be in the form of vomiting or even purging with exercise. But in binge eating disorder, when they overeat beyond what they want to eat and need, then they just go right into guilt and shame versus
Correct. And Yeah, some of my clients will report that, even they will vomit, but they're not making themselves vomit. I
Right,
mean, they've just eaten
right,
so much to the point of such discomfort
right.
that their lives and their health are really affected.
Right. And we want
Mhm.
to point out that it's not about food. Food is the coping mechanism here. So when somebody's triggered with some life event that creates distress or sadness or depression or frustration, the coping mechanism they choose is food. And the food does provide temporary relief. And it can also provide energy depending what they eat, but it doesn't last. And that's
Mhm.
the issue here. And then the cycle goes guilt, shame, and then again, life event. We all are going to have these life stressors throughout our life that we have to address.
Right. And it is so physiological too. Stress, you know, decreases certain neurotransmitters like dopamine,
Mhm.
serotonin,
Mhm.
melatonin. And those are serotonin and dopamine are your feel good drugs, right? When we see a puppy or if we hold a newborn, we get a flood of dopamine.
Yeah.
So during stress, those neurotransmitters, those hormones are decreased. What does food give you, especially hyperpalatables, which are starchy, fatty foods, salty foods? Those give you
Chocolate.
dopamine. Yeah, chocolate. Chocolate releases dopamine.
Yes.
And so your body physiologically is saying, give me dopamine, make me feel
Yeah.
better. And so
But
when you eat and binge, the dopamine floods and you do feel numb
yes.
temporarily.
Yes, and it's those cravings, those salty, sweet, sugary cravings that we want in those stressful times. Very rarely are we craving broccoli or cauliflower when we're stressed. And
Mm-mm,
so we have to be
mm-mm.
very mindful of this cycle and what's happening.
Right. And I think it's important to be mindful of the situation. Like, I am stressed.
Yes,
This is a stressful time.
yes,
We're in the midst of a pandemic. You know, Life has changed. Okay, to be very aware of that and grab all of your coping mechanisms if you're vulnerable to binge eating or addiction, right?
mhm,
That to really recognize, okay, yeah, I'm stressed or I'm angry or I'm lonely or I'm bored.
mhm.
What do I need to do to keep myself really healthy? Because I'm so vulnerable right now.
Exactly, exactly. So we know the statistics that it affects women more than it affects men. And we see it across all the age groups from adolescence, maybe childhood, and all the way up until your elderly years. People can have binge eating disorder for a lifetime. But
Mhm.
the good news is, which we'll talk about later, is there is recovery and there is treatment.
Mhm.
And so we'll talk about some of the success stories that Caryn has worked with. Okay, so what are some of the health risks associated with binge eating disorder?
Mhm. So the health risks are very similar or are the same as when a person is experiencing obesity, extreme obesity, morbid obesity. We see high blood pressure, type 2 diabetes, heart disease, gallbladder disease, joint pain, sleep apnea a lot. Some of my clients have been experiencing lately, and this is kind of new. I guess it's not new. Maybe they're just able to vocalize it now that they're having open wounds and
Mm,
rashes and sores, um, a lot of anxiety and depression,
mhm.
and really poor quality of life. If you think about how people in living in larger bodies, if they are living in a larger body, have experience the world, our world is not very kind to
Mhm.
people in larger bodies. So if the binge eating, is causing them to live in a larger body, they will report really having a poor quality of life.
Yeah, probably, due to a lot of the stigmas and discrimination associated with that.
Absolutely, absolutely. It's not, it's just tough. Having any type of eating disorder is it's brutal. But some eating disorders are glamorized, right? When someone has anorexia, they're oftentimes praised,
Yes,
right?
yes.
People don't.
I'm Generation X. You may remember this. I grew up in the early 90s when Kate Moss, who was known for her heroin chic body, very,
Yes.
very skinny, and that was glamorized and promoted as an
Yep.
ideal during that time in the early 90s.
Absolutely. I remember Kate Moss, right? She was a waif, right? But very, very much drug addicted. Yeah, and the beauty norms, or what is considered beautiful, has changed. It used to
Thank
be
God.
Marilyn, right? Well, it used to be Marilyn Monroe, who was beautiful, curvy, and then came Twiggy, and then it's
The
been
80s
back and forth.
supermodels and yeah.
Yep,
And today
absolutely.
I'm happy to see more representations of a normal, healthy body weight in advertisements and so on. I think that's a positive message to send to young girls and to anybody struggling with body image issues.
Oh, absolutely. Absolutely. You touched on the statistics, and I don't know if would you like to hear some of the statistics? So binge eating disorder is actually the most prevalent eating disorder of
Yes.
all of the eating disorders. It is recognized in the DSM-5, which is our manual of mental disorders, mental illnesses. And it is the most prevalent. It's the hardest to treat, I believe. And because people this is kind of making generalization, but it's a long road, right?
Yeah.
Recovery is a very long road, and it's not life threatening like anorexia and bulimia are. And so, and a lot of times people want the quick fix. They want, let me just lose the weight. Let me just have gastric bypass.
Yeah.
And then that's not the answer. Doing the work is the answer.
Right.
But binge eating disorder is very prevalent. It's the most common eating disorder. I have my statistics. Let's see, about 3.5% of American women and 2% of men, and up to 1.6% of all adolescents suffer with binge eating disorder. And total is about 3 million Americans struggle with binge eating disorder.
And
And
that's what's reported. Could be high.
yes, it could be higher, right? That's a great point, because people have a lot of shame and they don't want to come in, because our society looks at it as, well, just diet, just lose weight, just stop eating,
Yeah.
just go out and exercise.
If it was that simple.
Correct. And it's not. It is, it's very hard. Our brains are very wired for habit, right? 99% of what we do is based on habit, and it's hard to change. Luckily, our brain is very neuroplastic. It can change, but it takes a lot of work. So, but people are hesitant to come in with binge eating disorder because so much of society says it's just a lack of control, or these
Right.
people are very lazy. Yeah. So there's a lot of shame involved in binge eating.
Right. And I'd like to point out that there is another name that you might have heard binge eating disorder as compulsive overeating. It's another common term that people use. So let's talk about some contributing factors. What's driving this? Starting with social, cultural factors. We touched on, the media and the models, and that being one factor that we grew up with in our time. What are some other social, cultural factors contributing to binge eating disorder?
Yeah, so the sociocultural, there is a lot of pressure. This is kind of repeating what we said, but a lot of pressure to obtain a certain body type. And when one doesn't fit into that body type, they're might be bullied, shamed. They don't feel like they fit in. They might feel awkward. I have a lot of clients who say, when I grew up, all my friends were these little skinny, just genetically, these little skinny twigs. And I developed breasts, and, I grew, and I was going into puberty way before everybody else. And nobody tells boys and girls how hard puberty is, and that girls are going to go out and get hair and stuff, whereas boys are going up. And so So the feeling of maybe not fitting into society's standards or society's pressure or what their friends look like. Social media
Yeah.
and marketing is just brutal
Especially
on.
the diet industry. It's a multi-billion-dollar industry that targets people's weaknesses, maybe naivety, and
Mm.
of course their wallet. And so you have to watch out for the unscrupulous diet industry.
Diet industry is, oh my goodness, brutal. The diet and beauty industry, yes. And there's always a new diet out there, and it looks so promising and so enticing.
Yes.
And so that's social. And then the normalcy of diet culture, which is just what you
Yeah.
said, that, kindergartners bringing in Diet Coke, or talking about, I can't have that, that's too much sugar, or I'm not going to bring in a cupcake because I'm not going to eat that. That's got too much sugar.
Right. Right.
Kindergartners, yeah.
Mm.
So that's a society, places a large. There's also, right, of course, like the Barbie dolls. I mean, it starts young. It
Yes.
starts with fairy tales, Sleeping Beauty, Snow White. These very, very thin
Yes.
fairy tales, and then it goes on to Barbie, and then the models, and it just keeps going on. And that's a lot. I think it's been reported that we get 2,000 media messages at least per day.
Yes, and it even targets men. You look at the action figures of GI Joe from the 1970s. He's kind of normal weight and frame to being superhero muscular strengths, impossible to obtain without steroids. So yes, men are targeted. Young boys are targeted as well as girls.
Absolutely, absolutely. I don't know if you've seen, well, I'm sure you have seen the ads where the men, their muscles, right, are so defined and their pants are really low, and yeah, it's a lot of pressure. So
Yeah.
the society it's a big um, contributing factor to binge eating disorder, all eating disorders. Mhm.
Yes. I always like to say culture is not your friend. Go counter culture. A lot of times what culture is trying to sell you and tell you these are your values and norms, it's probably just the opposite. So go counter
Correct.
culture.
Correct.
Another contributing factor is interpersonal and psychological factors. Can you touch on that?
Yeah, yeah. So typically, a person who develops an eating disorder is really a deep feeler, a strong feeler, an empath, right? Which is a beautiful thing to be a deep feeler. But it's also can be dangerous in terms of self-preservation. So someone who might get teased, right? For someone who is not an empath, that teasing would go right over their head, or, well, oh, go away. But for an empath,
So you're talking about people who are super sensitive.
super sensitive. Yes. Yes. Super sensitive. That is one of the interpersonal psychological factors. Perhaps they have low self-esteem, right? So they're feeling insecure. And maybe then they don't look like what society expects them to look like. So all these, it's kind of like the perfect storm.
Yeah.
Maybe they have depression and anxiety.
Hmm.
Maybe they have a lack of coping skills. They haven't been taught, or it hasn't been modeled how to really take care of yourself, how to cope with life's difficulties. Perhaps they have difficulty expressing their feelings,
Hmm.
right? Perhaps they have a history of trauma or abuse.
Hmm.
And then perhaps we see a lot of OCD, obsessive behavior, compulsive behavior, perfectionism, sensitivity, just like you said. So you take these factors, they might not have all of these interpersonal factors, but maybe they have some. And then you add society's pressure. Yeah. And then
Yes.
the final one, which I know you'll
Yeah.
mention.
I just want to touch on what you
Oh
were saying,
yeah.
poor coping skills and the poor communication skills. Sometimes people fall under this category of being people pleasers. They have
Yes.
difficulty saying no to other people,
Yes.
but they also have difficulty saying no to themselves. The boundaries are broken on both ends there, and they have to
Correct.
do the work to repair that so that they can build their confidence and build their communication skills.
Absolutely. Boundaries is a huge word, and it's such an important part of life. It is being able to say, okay, you know what, this is what I will allow in my life, and this is what I won't allow. And people have to respect my boundaries.
Yes. And you
Yeah,
are the one in charge of enforcing those boundaries. That's the key
correct.
thing here too.
Right.
The third contributing factor I'd like to touch on is biological and biochemical factors.
Yeah. So this is an area that's not well researched. They've been doing a lot of research on the biochemical, biological factors, genetic factors. They've done a lot of studies on twins that both have eating disorders.
Mhm.
Yeah. And like I said, the research it's pretty new, it's young, but they are showing genetic links.
Mhm.
And oftentimes we will see that there's a family history of eating disorders. We'll say family history of binge eating passed down, mother to daughter. And then, so if you take the brain and the genetic predisposition, plus then the family environment,
Yes.
right? And
Yes.
watching your mom have her coping mechanisms, and that's what you're seeing, and that's what you're adapting to. There's also chemical imbalances that are genetic, and the chemical imbalances that directly relate to hunger, appetite, and satisfaction or satiety.
Mhm.
So there is a genetic component for sure. Just like we know that if you have a schizophrenic parent, one parent, there's a 50% chance you're going to have schizophrenia. Both parents have schizophrenia. Yeah. So it's the same. There's a genetic link to eating disorders, addictions. Or when people say, when you have parents or grandparents that are alcoholics, you have to be really careful because you might
Mhm.
have that gene.
Mhm.
Same with eating disorders.
Yes. There's kind of a nature nurture. Both of them come at play here.
Yeah. Yep. So you take the genetic, the sociocultural, and then the interpersonal, and it is a perfect storm. And
Mhm.
then there's usually something that is, the straw that breaks the camel's back.
Right.
Something sets them down that pathway.
Right. And I like that you touched on the brain and eating disorders, but I'd like to point out we know very little about the brain. We need much more research to see what's really going on and how things are operating. One thing that we used to think about the brain is that we thought serotonin was made in the brain. And then we
Mhm.
found out, no, the majority of serotonin is made in your gut. And
Mhm.
so we were treating the brain without treating the gut. And this
Mhm.
is obviously causes problems.
Mhm. And they so work together, that you get the
Yeah.
gut feeling. There's a reason that because this brain and this brain are
Yeah.
working together constantly.
Yes. And a lot of times people shut down. They shut down their instincts when they shouldn't, or they detach and shut down their thoughts and their feelings when they shouldn't.
Mhm.
So that also creates the perfect storm.
Yep. Mhm.
So let's get into recovery and treatment. I know from your background and your experience, you advocate multidisciplinary approaches. And can you go ahead and speak on that a little bit?
Absolutely. It really takes a village, right? One clinician can't do it all and shouldn't. It takes a whole team approach to help someone recover from an eating disorder. And it starts with a medical doctor. A medical doctor has to be involved because there's complications no matter what spectrum, what side of the eating disorder you're on. You need a medical doctor involved, monitoring the labs, monitoring your health
Mhm.
with no shame and judgment. It's all, this is it. This is what the person has. This is what they're struggling with. And so we pick doctors who really understand eating disorders and that are compassionate and kind. And if someone comes in with an open wound, you know, okay, you know what? Let's treat it
Mhm.
with kindness and compassion. Okay, so the doctor, psychiatrist, for the meds. And again, the psychiatrist is one that knows and understands eating disorders because they're so complicated.
Mhm.
Um, and oftentimes the psychiatrist will say, these meds aren't going to work until the person is stabilized nutritionally. So dietitian has to be involved, a registered licensed dietitian,
Yes, not a nutritionist. Can you
not
speak
a
on
nutritionist.
Can you tell the difference for the audience between a registered dietitian and a nutritionist?
Absolutely. It's a big difference. So a registered dietitian, nutritionist, RDN, has gone through years of undergraduate work, undergraduate training, very specific classes, nutrition classes, metabolism classes, medical nutrition, MNT classes, all the sciences, biology, microbiology, anatomy, physiology. So they finish a 4-year degree in nutrition, and then they are eligible to apply for an internship. And the internship is at least 8 months. It could be a year, it depends on the program. And the internship is in hospitals, in private practices, in food service industries, all the different nutrition industries. And then after they finish their internship, they're eligible to sit for their board exams.
Right.
And so then when they complete all of that, they become a registered dietitian.
Licensed, and yes.
Well, licensure is based on states.
Oh,
Not
okay.
all states are licensed. Texas is a licensure state. We have to be licensed in Texas, but other states don't require a license.
Okay.
But RD, you have to be the registered dietitian to practice nutrition anywhere in the United States.
Yes, so make sure they have those credentials behind their name.
And you want to find, if you're going to get help, which I so encourage, find a dietitian who specializes in eating disorders.
Yes.
So that you don't go into, let's say, a hospital dietitian who means well and is a great clinical dietitian, but doesn't understand, eating disorders, and might, inadvertently put you on a diet or a meal plan, right? Which is maybe not the right treatment at that time.
Mhm.
So, okay, so a medical doctor, psychiatrist who is a medical doctor too, dietitian, therapist, a licensed LPC, licensed professional counselor, or social worker, licensed social worker,
Mhm.
again, who understands eating disorders, because it is not about food, it's not about weight, it's all the underlying issues that we've discussed, all the issues of not feeling good enough, not feeling smart enough, not feeling enough, and then finding this coping mechanism.
Yes.
In
I want to
food.
touch on that real quickly about the importance of identifying and recognizing feelings. There is a great tool. It's a color wheel of emotions. Do you know what I'm talking about?
Yeah. Mhm.
I'll
Yep.
put a link in the description box for those who don't know. But oftentimes people might be emotionally illiterate when it comes to describing how they feel. They may only know sad, mad, and happy, and they don't dig deeper. They don't go into, well, why am I sad? Well, I'm sad because I was humiliated, or I was confused, or you have to dig deeper into those not so good feelings. And a lot of times people don't want to do that. They don't want to, what I say is, feel the feels, and you got to feel the feels to get better. And I think something like this tool, the emotion wheel, helps you name the demon so that you can tame the demon.
Yeah. And feelings are for feeling,
Yes.
right?
The
Feelings are
messages.
for feeling. Yeah, and we learn, and so when someone has binge eating disorder, the feelings that come up are numbed with food,
Yes.
right? Or if there's a trigger, I don't want to go there, I don't want to feel that feeling, I know what's going to numb me and take me away. One of my clients last night said now that she's in recovery, she has so much time, so much more time. Before she, numbed herself, she had no time because all of her time was spent thinking about food, how was she going to get food, then binging on food, and then feeling awful. So feeling the feelings and being able to process those feelings.
Yes.
Particularly with the therapist, because those feelings can be really strong.
Yeah.
And
You need somebody to help you navigate it. Again, no shame, no judgment. Find a therapist that is compassionate and kind and understands and specializes in eating disorders that can help you kind of get to the root cause. And, feelings can be horrible and they're fleeting. That's the good news and the bad news. The good ones come in and they also leave, but the bad ones come in, but they can also leave. So sometimes you just have to ride those feelings, and a therapist can definitely help you navigate that.
Absolutely. And, to watch someone sit with the feelings in a group,
Especially uncomfortable feelings.
uncomfortable feelings, they do pass.
Yeah.
We have watched people cry, throw temper tantrums, yell and scream, and then the feelings pass. But if you numb them, you have not resolved the
It's
feelings.
like
You
a
haven't.
pressure cooker. If you keep numbing something, it's like putting balls below the water surface, and you can't keep holding those balls down. Eventually they're gonna explode, and that's how your feelings will come out one way or another.
Correct. Feelings are for feeling, and it's okay, right? We're human. We have feelings. We own them. That's okay.
Yep.
That's
It's the
okay.
experience.
Yeah,
Sometimes you've got to keep a sense of humor about it all and just enjoy the ride.
exactly. That's true that. Mhm.
Anybody else in your team of helping people with besides a doctor, a psychiatrist, a registered dietitian, a therapist? Anybody else?
Forgot that's what we were talking about. Okay, yeah. Well, I love support groups
Mhm.
because people are wired for connection. And
Yes,
so if you can connect to others who are struggling with something similar, you realize I'm not alone.
exactly. Mhm.
And so I have a free support group Monday nights, and it's actually open to anyone in the country because it's on Zoom. So it's
Awesome.
not just, yeah, it's also not just local anymore, and it's free. And the support group has been very successful just in that way that people are connecting. They have a common bond and they really support each other. And so they realize I am not alone in this struggle.
So they can just drop in. They don't have to like show up with the diagnosis. Can it just be somebody that has overeating behavior issues?
So they have to be screened by me, and then I'll put them on if they're appropriate for group. Not everyone has been appropriate for group. Someone with a very, very diet mentality is not going to be appropriate for group. I'm trying to think. Someone who's very triggering, right, is not appropriate for group.
It
We've
might
had
people.
I'm sorry.
They might trigger other people in the group.
Correct. And there's certain rules with group, like no numbers, no weights, no specifics of food, because that could be very triggering. For example, if someone says, I binged on a cupcake, right? Someone else might be thinking very shamefully, what? You should see what I binge on,
Right.
that's not a binge, that's a nibble. So we're very careful with our vocabulary and wording, and there's certain rules of group. So anyway, someone has to be screened by me. And then if they're appropriate, I always say, try it out a few times and we'll know if you're a good fit for group or if the group is a good fit for you.
Yeah. Do you have, I would imagine for people who are going through binge eating disorder and do feel alone, it's important that you reach out to friends and family and also get their support. And do you ever have friends and family come to your support group?
That's a good question. Sometimes we've had spouses come. We have to be careful. Sometimes friends and family are great support, but sometimes we've got to be really strict with boundaries, because friends and family, if they don't understand the illness,
Ooh,
like
can be
sometimes,
counterproductive. Yes.
yeah, sometimes moms will say, I just had a mom tell her daughter who's going to New York, you're going to get bullied if you don't get, get in shape more. And so sometimes, we have to coach. I think parents and family and friends, they usually mean well, not always, but they usually mean well, but they just don't get it. They just don't understand the illness. So if they're coachable, we'll coach them what to say, what not to say, how to work with a family member who is struggling. So sometimes family members, I'm trying to think if family members, it's really been spouses only, boyfriends and spouses who have come.
Yeah. I think it's important that if you do have binge eating disorder, that you don't lead with that and you don't define yourself with that. because then it becomes like the sole focus of your life, and you want to minimize that part of your life, like it's down here, so that other great things can come forward in your life. What other tips or advice would you give to somebody struggling with binge eating disorder?
Yeah, is a lot of self-compassion, a lot of self-compassion that you're human, you're struggling. Food is, it makes sense. I mean, food is,
You got to have
it's
it.
physiological, right? You have to have it. It's comforting. If you think about, like, people say comfort foods,
Mhm.
and so it's makes sense that people would have a problem with food if if they're wired for, you know, using a coping mechanism.
Mhm.
So I would say first be very self-compassionate, learn about the illness, truly understand it with compassion. Um, realize the life. Like, I always use the phrase, if I had a magic wand, what would your life be like? What would it look like? How would
Visualizations
food?
are good.
Mhm. And
Think
then
it,
let
become it. Yes.
let's work towards that,
Mhm.
because it is possible.
Mhm.
Recovery is possible for sure. And I always say, here you are, you're doing the work. You showed up
Yes.
and you keep showing
Step
up.
by step. If you can just be 1% better today than you were yesterday, you're making progress. And you have to
Ab-
look at it that way. You don't expect, overnight. And just like you didn't get the eating disorder overnight, it's going to take a process. But the good news is recovery can happen. You can get treated. You don't have to live with binge eating disorder for the rest of your life.
Absolutely. Absolutely. And you learn so much about yourself when you go through recovery.
Mhm.
First, you learn you are so resilient,
Yes.
and wow, I'm always so impressed by people who go through recovery. Of, like, look how much you're never the person that you were before.
Mhm.
And, e- even if there's setbacks, which there
Sure.
usually are, there always are.
Mhm.
And we learn from every crisis is an opportunity.
Exactly.
Keep growing and keep growing and keep changing.
Mhm.
And so, what an amazing experience
Mhm.
that you have been through. Look how much you've learned about yourself. Look how much you've grown. Look how much you've changed. Look who
Yes.
you are now,
Yes.
and what positives can you take with you?
Mhm. And
Uh,
like you struggled with an eating disorder, and now you're helping people with an eating disorder. So there's always a purpose and silver lining to even negative things that happen to us. We just have to turn it that way.
Absolutely. I think this was, if I hadn't have gone through anorexia and bulimia in the 80s,
Yeah.
who knows what I would have been doing now,
Playing
So
tennis. You'd be a pro player.
Maybe. My first career was actually television and radio. I was a TV reporter.
Oh shoot, then you're a natural here.
I'm passionate, about this, but right, who knows if I hadn't gone through that experience. So everything serves a purpose. And
It,
I always tell my clients, there's a reason you're going through this,
yes.
whether it's to bring the family together
Yes.
or whether it's going to be your future. And a lot of people who go through eating disorders go into this field.
Yes.
Um, there's a purpose,
Yes.
there is a purpose.
And there will be a full circle moment for you when you go through it, and you'll have an epiphany and understand your struggles and understand overcoming those struggles. And that full circle moment will feel amazing to you. So I encourage you to keep working hard if you do have binge eating disorder, because you can recover, you can get treated.
For sure. For sure. And recovery is beautiful. It's a beautiful life on the other side.
Yes.
Yeah.
And and if you have recovered from binge eating disorder, if you could leave a description down below and let us know what was some of your turning points, we would love to hear from you and your comments and feedback. Do you have any other closing remarks before we close out?
Yeah, I think it's so brave when someone does choose the path of recovery, and it's never perfect, and
Yes.
it's hard and it's slow, and we always say progress, not perfection. And even when someone is in recovery, you know Are there triggers and are there vulnerabilities? Absolutely. But you learn to either those triggers become fleeting thoughts, or you learn to say, wow, I'm really vulnerable today. What do I need to do to stay in recovery? Because I have so much to lose and I've
Yeah.
worked so hard. So it's never a perfect journey. It's a beautiful journey. It's a journey,
Yes.
but it's never perfect.
Yes. And you don't have to do it alone. So thank
Yeah.
you, Caryn. It was my pleasure. I'm so privileged to have you today here on my YouTube channel. If you like this content, please like and subscribe and hit the bell so you can be alerted when new content is dropped. So thanks for watching.
Thank you. Thank you so much for having me.
Thank you, Rick. Thank you, Caryn. Take care. Bye.